Hi, my name is Vidisha Mandal. I'm a health economist in Washington State University. My project is titled Medicaid's Non-Emergency Medical Transportation, the Critical Role of Mobility Services in Accessing Behavioral and Preventative Care. Availability of reliable and affordable transportation to healthcare providers is critical in receiving timely medical care. However, many low-income individuals lack this facility. Transportation gaps are also more likely to affect older individuals, rural residents, and those suffering from chronic conditions. My research focuses on understanding NEMT demand among Medicaid beneficiaries. States partner with the federal government to provide Medicaid benefits to their eligible populations. States are required to provide Medicaid beneficiaries with free or subsidized NEMT to healthcare appointments. States have tremendous flexibility in how Medicaid, including NEMT, is administered. Each state has its own NEMT service structure. Washington State operates a regional broker model. Launched in 1989, it is one of the oldest regional broker systems in the country. It includes 6 community-based brokers across 13 regions. According to a 2014 National NEMT survey, the estimated annual NEMT expense in 2013 was close to $70 million, including 2.8 million trips. While the implementation of the Affordable Care Act in 2014 was one of the largest healthcare reform in the U.S. in recent past, Washington State overhauled its NEMT system pre-ACA in 2011. In the same year, it also received federal assistance to sustain some state-based health coverage programs to certain vulnerable adult subpopulations, such as those in the Alcohol and Drug Addiction Treatment and Support Program. Adults in these programs were transitioned into traditional Medicaid in 2014. In this project, I examined NEMT demand change between 2010 until 2013 among Medicaid beneficiaries, with a focus on metro and non-metro differences. I found that the age composition and the metro-non-metro composition of Medicaid beneficiaries were similar in all 4 years. In all 4 years, around 46% of the beneficiaries were young children, 14 years or younger. The remaining 54% of Medicaid beneficiaries were older children and adults. In all 4 years, approximately 77% of Medicaid beneficiaries were metro residents and the remaining were non-metro residents. However, between 2010 and 2013, there was a 1.3 percentage point increase in NEMT use. Demand increased at a faster rate among young children and among metro beneficiaries. Demand increased twice among young children compared to 15 years and older. Demand increased 1.5 times among metro beneficiaries compared to non-metro beneficiaries. Interestingly, the average number of rides per day did not change over the 4 years. It was approximately 1 ride a day amongst NEMT users on the day they needed transportation, and this average was similar across metro and non-metro use. On the other hand, since the 2011 system overhaul, there were substantial cost savings in both metro and non-metro areas. Looking at the most common health concerns, conditions, and diagnoses among young children, I found that NEMT was most frequently used in metro areas in 2010 and 2011 for routine child health examination, for care for asthma, autism spectrum disorders, chronic kidney diseases, and depression. In those years in non-metro areas, the most commonly reported health concerns amongst NEMT users were ADHD, asthma, bipolar disorder, and drug use disorder. However, coinciding with the increase in NEMT use, I found both in metro and non-metro areas in 2012 and 2013 an increase in preventative care such as routine child health exam, care for learning disabilities, as well as needing flu vaccines. Among older children and adults, the most commonly reported health concerns and diagnoses were depression, schizophrenia, and other psychotic disorders in 2010 and 2011. Coinciding with increase in NEMT use in 2012 and 2013, the most commonly reported health concerns in this age group were diabetes, hypertension, and prenatal care. To summarize, NEMT use increased in 2012-2013, especially among young children and Metro beneficiaries. However, there were also substantial cost savings since 2011. Medicaid children frequently used NEMT to access preventative care, including routine health checkups and immunizations. Adult beneficiaries frequently used NEMT to access behavioral health services and for neonatal visits. There has been significant increase in number of Medicaid beneficiaries post-Affordable Care Act. We also expect increase in enrollment into Medicaid during COVID-19 induced recession. Additionally, there has been integration of substance use and mental health treatment patients into the system. Thus, to improve beneficiary experience and to continue to reduce cost, modernizing NEMT might be necessary through on-demand ride-sharing. But data are limited on use of Lyft and Uber, as most states prefer to continue using traditional NEMT since drivers have to be trained to take care of Medicaid patients during the ride. Washington Department of Health is currently partnering with Lyft and Uber to access COVID-19 vaccines. This could serve as a useful learning experience on whether ride-sharing could be part of NEMT in the future.